women in medicine. And we would like to thank Dr. Laurie Solomon, Chair of Family Medicine, and also the Diversity and Inclusion team for working with us to have this presentation. And if you have any questions, like you could please wait for us to finish our presentation. And then we will have time for a discussion. And the way we are going to do this is Amy and myself will be presenting, and I'm just going to ask our, the team from Jason, who's overseeing this from the Office of Diversity and Inclusion. Like, are you going to start taping now, Jason?
Yes, the recording started.
Okay, thank you so much. So we have no conflict of interest, and very briefly, these are the objectives of our presentation. And the way we're going to do it, I will be presenting, followed by Dr. Ansel, and then both of us are co-presenting. So one of the objectives here is, as you can see on the slide, we will be discussing the interlinkages between the Sustainable Development Goal 3, which, as you can see on the top, is good health and well-being, which we have on the header, the little icon across from the New York Medical College icon. And also we'll be discussing and highlighting examples of how women health professionals have improved the health status of the communities they live and they work in by promoting the targets of Sustainable Development Goal 3. And we will be discussing recommendations. So very briefly, the introduction is, as you can see on this multicolored slide, that there are 17 global goals, and we will be discussing today good health and well-being and the importance of partnerships for the goals. But I would like to just tell everybody that the Sustainable Development Goals are like a three-dimensional puzzle, because you cannot achieve the targets of one goal without making sure the other goals targets have been addressed. So that's why partnerships are so important. Now, the Sustainable Development Goals were actually adopted in September 2015 at the United Nations General Assembly. And I had the opportunity of being there. Like, this is the week of the General Assembly. Usually General Assemblies start in the month of September, and the UN General Assembly is going on. And the second week, which started today, that is Monday, is very important, because that's when the high-level thematic debates are discussed and where the progress of the Sustainable Development Goals is reviewed. So alphabetically, S is after M, but we had the Millennium Development Goals, which were adopted by the member states in 2000. And then in 2015, the Millennium Development Goals, which were 8, and now to encompass a broader range of subjects and to address more challenges, the number of SDG goals adopted by the member states of the United Nations is 17, as we just saw. So these photographs are from the United Nations, where I was there this weekend attending some special sessions. And as you can see, this is the UN building, which is lit up with the Sustainable Development Goals. Like, the whole building is lit up and it's projected. And I just want to tell you how important this is, that the world community and the heads of states and the world leaders and the policy makers from across the world meet here to discuss the Sustainable Development Goals. So each goal is highlighted, and I have the picture of Sustainable Development Goal 3, which kind of really gives a brief segue in what Dr. Ansel and I are going to discuss, because what are the things associated with SDG 3? How can we promote good health and well-being? And one of the most important things is to be physically active. So these are the photographs from the United Nations, which will be lit up till the end of this week with these colors. So what is SDG 3? As we can see, it's to ensure healthy lives and promote well-being for all at all ages. So this infographic, it really just shows us like what are the issues. And one of the reasons we have to be concerned is as a result of COVID for more than 2 years, we are into the third year. We've been facing tremendous challenges, not only in the United States, but globally. And unfortunately, there have been so many disruptions, especially with access to healthcare. And this has really reversed decades of improvements we have made. And as you can see, this is the scary part, that childhood immunization programs have been interrupted in 70 countries as a result of COVID. And this is where health professionals came in, because majority of the health professionals are women. And even though most of the women are not in leadership position, majority of them are working in healthcare. And also, they are the ones who are out there day in and day out trying to care for the people, whether they're physicians, nurses, a physical therapist, speech pathologists, nurses, aides, social workers, midwives. Everybody is at the forefront trying to address the health needs of the communities to make sure that women have healthy lives and the whole community. So this is like really important. So that is why when we discuss, in the US, we celebrate Women in Medicine Month as September, but we during this presentation, we also like to highlight, because it's just not physicians doing this, it's a team of dedicated band of professionals who, and most of them are women. So moving on, again, this infographic, as you can see, has the number of targets. And very briefly, in my next slide, I'll be discussing what each target is, because just to kind of go back a little, the Millennium Development Goals had 3 specific health goals, where you had goals to address infant mortality, to reduce infant mortality, to reduce maternal mortality and morbidity, and also to reduce, infectious diseases like HIV, AIDS, and TB and malaria. But now all the 3 goals and other indicators have come under the umbrella of the Sustainable Development Goal 3. So as you can see, target 1 is to reduce illness and death from hazardous chemicals and pollution, which includes both water and air pollution. And we need to be so concerned, because we are, we can see the effect of climate change, where the water supply is getting polluted. As we know, we've had an outbreak of polio in 2 of the counties in Hudson Valley. And this is because of contamination of the water, when, we've had a resurgence of polio. So when we talk about the SDGs, it's so important that we do also look at what are the socio-economic determinants, and where somebody lives, which is contributing to it, and how the women health professionals are so crucial in addressing this. The next goal is to reduce the global maternal mortality rate to less than 70%, and all 3.2, as you can see, ends all preventable deaths under 5 years of age, including infant mortality due to diarrhea, due to pneumonia and malnutrition. So again, in order to address this, it cannot be addressed without the help of the dedicated band of women health professionals. I'm not saying it because I'm a woman, I'm a healthcare professional, and not that men don't matter, but it's just that the most of our healthcare sector globally is made up of women. Again, the number of women are outnumber men in the healthcare sector, but the number of men in leadership positions is significantly more. I just want to clarify that. And end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases. That's what NTDs are. And to reduce premature mortality from, again, NCDs, and promote mental health. strengthen prevention and treatment of substance abuse, and to reduce deaths and injuries due to road traffic incidents, which are accidents which are becoming so high, especially in low and mid-income countries, and ensure universal access to sexual and reproductive health care services, and to achieve universal health coverage. So you can see these are, in a nutshell, the infographic which breaks down each sustainable goal or 3 target. And also every year the progress made with regard to these indicators is discussed, and it's looked at to see what worked, what didn't work, and are we lagging behind, or where are we? So now, I just want to tell you AMWA partnerships, because AMWA is also co-sponsoring this, and I have the proud privilege as serving as the global health lead for AMWA. So AMWA, we have been working to have a series of webinars right since the beginning of COVID, where we reach out to our international colleagues and friends. And the latest one we had was last week, September 13th, which was well attended by people from all over. And this is really important because it brings together, again, women professionals to discuss what is happening now with the vaccine, and what is happening, and how are women still bearing the brunt of addressing COVID, not only as healthcare professionals, but also in families and trying to juggle things. And one of our international colleagues spoke about the challenges faced with regard to PPE, because unfortunately, there is very little gender specific PPE available for women. So a lot of times women do not have the same protection as men because they're wearing ill-fitting PPE. So I just wanted to bring that, and that is something where there's a lot of studies going on to see how can we have PPE, which is kind of gender specific, so that it caters to and meets the needs of women effectively as it does for men. So with that, I'm just going to turn it over to Dr. Ansel to take us through the next few slides. Over to you, Dr. Ansel. Thank you.
Thank you, Dr. Murthy, and it is really great to see all of you in this evening's presentation. We thank you for taking the time out this evening to join us. So I'm going to speak about local efforts by NYMC to promote Sustainable Development Goal 3. One of the many things I've learned through my collaboration with Dr. Murthy is the importance of thinking globally and acting locally, which is a very famous and apropos citation from the World Health Organization. So I'm going to speak about local efforts to do this by local action to demonstrate our global thought process and have an impact. So faith-based initiatives, partnering with any form of religious institution, whether it's a church, a synagogue, a mosque, any type, a temple, a Hindu temple, faith-based initiatives are very important and powerful ways to reach the community. Child care provider education. We have Head Start programs. We have so many daycare centers located throughout the country. And education, providing education and partnering with child care provider associations is very important. During the time of COVID, Dean Robert Amler, and I did numerous presentations for child care provider groups because, as you would think, they had a lot of questions and there was a tremendous amount of anxiety about whether to come to work, whether to vax, not to vax, how to reinforce vaccinations. Food insecurity. We're dealing with a tremendous food insecurity problem right now in this country. A recent survey by one of our big community partners at NYMC, Boston Children's Health Physicians, yielded about 20% of those surveyed, those patients surveyed, were indicating that they were worried about where their next meal is going to come from. Tobacco cessation. There are numerous initiatives and partners, the American Lung Association, tobacco cessation programs are happening all over the country. We're doing one with Boston Children's Health Physicians, and screening for tobacco and referring, assisting patients and their families is very important. The social determinants of health and public health education. This really dovetails into our mission statement at New York Medical College. New York Medical College mission statement is to foster community outreach. And our strategic plan that covers the years of 2021 through 2026, we actually state that it is significant for community outreach to continue to help address important issues, including health disparities and the social determinants of health. And this happens through community organizations, governmental and non-governmental, and advocacy programs. Advocacy is a very important tool when we're promoting SDG 3, which leads to SDG 17, partnerships. I'm talking about a lot of partnerships. Asthma is one of the most prevalent diseases in childhood. It's also very prevalent in the adult population. Another great example of partnerships, training workshops on asthma, clinical consults, pediatric environmental medical service. We have Dr. Robert Amler launched a PEMS program in conjunction with Boston Children's Health Physicians, and we do this in the PEMS program. Research. Research is significant. It's part of New York Medical College's strategic plan, its mission statement, and this is something that is enhanced by partnerships. Next slide, please.
Just a sec. Sorry about that. Okay, sorry.
I listed a few other examples, Stop the Bleed. We've got hundreds of student clubs, early intervention programs, early language development. On our campus at New York Medical College and the School of Health Sciences and Practice, we have an incredible clinic that helps people with speech and language delays, with early language development. We also support early intervention programs. We have a dysphagia certificate and program. These are all other examples of partnerships and of meeting our mission at New York Medical College to improve and enhance the health of populations. Local efforts to promote, yeah, exactly what I said. Plus, in addition to that, we also have La Casita de Salud. Maybe you're a student who's participated and you're watching right now, and you've been to La Casita de Salud, or you've done the Asylum Clinic, examples of things that we've done to collaborate with Westchester Medical Center. Next slide. Dr. Murthy, do you want to do this one?
Yeah, thank you. Thank you, Dr. Ansel. So continuing to, in the light of what Dr. Ansel presented, these are some of the local efforts we have been doing pretty actively. So in this, you can see the medical students from the School of Health Sciences and Practice, and also from the basic sciences. So all of us work together with the First Lady of the Permanent Mission of Malawi, whom you can see here, Kelly Ernst. And we will all work together with the First Lady of Malawi, Madam Kalista Mutharika, previous First Lady, former First Lady, on a Safe Motherhood project. And I'm so happy and proud that all the efforts by everybody across the 3 schools of the students resulted in collecting money, which was used to build, which was transferred to Malawi, and it was used to build a safe motherhood waiting room. Some of the funds went for that. And then we shipped out more than 400 safe motherhood kits, which were distributed because Malawi is a very hilly area. People did not have access to facilities, transport to go to the hospital when they're delivering. It was like a 2 our walk each way. So this really helped. And unfortunately, Malawi has one of the worst maternal mortality rates because there's such a shortage of trained obstetricians and even general practitioners. So the ratio is very low between the population and a healthcare provider. So this was a signature project which we launched, and it was so nice because all the 3 schools got involved, and it was a pretty successful project. Over to you, Dr. Ansel.
Yes. Other examples I mentioned briefly about faith-based initiatives. Well, this is the Children's Environmental Health Center of the Hudson Valley, and we are a team. And this is another concept that I really want to make sure that everybody is familiar with and knows how important it is. We're an interprofessional team of doctors, nurses, public health professionals. We have a nutritionist. We have a couple students with us. And we've been doing a lot of work with a lot of churches, in the Hudson Valley region, promoting a Not One More Life program where we do spirometry 360 and we provide important health education to people who may have trouble breathing. So this is an example. We are here at a site that at a local church, and we are giving our presentation. And you can see we even have a young, junior member in training, in the group, all the way at the picture on the end. Next slide, please. Dr. Murthy.
Thank you. Thank you, Dr. Ansel. So continuing with the efforts, what Dr. Ansel talked about, local efforts which have a global outreach. During the COVID crisis, this is what we did from AMWA. We partnered with other, the private sector NGOs, and you can see all these are the oxygen concentrators which were shipped to India, and we were able to liaison with the Tata Foundation, which is one of the largest philanthropic foundations in India, and they had a tie-up with Air India and FedEx. So all the money collected was not used for overheads. It all went to purchasing these concentrators because there was such a dearth in India then, because FedEx and Air India transported them free of cost. So this was good because the joint efforts of everybody, to illustrate what we talked about, global partnerships, we were able to raise 4.5 million. So I can't say, oh, we worked and raised it. It was, yes, we worked and raised it as a team. So that's why this is all what we have been doing. And again, women health professionals were at the forefront because AMWA leaders in organizing these efforts. Again, this was another thing which I'm very proud to have been involved with. Like you can see, we were able to send these, you can see here, masks and rice and wheat and other supplies to Mother Teresa's Foundation in India, because they reached out that they did not have an issue. So they could not get supplies because of all the curfew, the shortages. They had so many people, indigent people, they had to feed. So we reached out to them, and by working with faith-based organizations and another private sector, youth from Canada, and with local people, we were able to send these. And also, this is another thing where AMWA worked with the private sector, with Suchi, which is a Buddhist foundation, faith-based, along with the Attorney General's office in Arizona, and with the medical students. It was called, Project Pegasus, where we dropped over 80,000. And then we had the pilots from one of the private airlines there who donated their time free. And there were 80,000 masks dropped in the Navajo Nation, along with 3D printing plastic shields. Again, so it was technology, it was women in health professions and students, everybody got together. So again, the power of partnerships. Now, so just very briefly, we are going to show this video of what Elizabeth Blackwell was, because as we know, she was the first woman physician in the United States, technically, officially licensed, and she was an immigrant from the United Kingdom. who practiced medicine. And, it's on her shoulders that a lot of us in healthcare have taken lessons, because her birthday was celebrated recently. She turned 200, because in those days, she was an advocate and a trailblazer. Jason, could you please play the YouTube video? Thank you so much.
Yeah. So let's put this on. Can you see my screen?
Yeah.
Okay, great.
Thank you.
Bye.
And we are showing this because AMWA is also co-sponsoring this. And we are honoring women who have made a difference during this month of women in medicine. Thank you, Jason.
I would just like to add for everyone that our very own Dr. Padmini Murthy was honored. She is a Blackwell medalist in 2016. So it's really very special that we have her at New York Medical College. I would also like to acknowledge that Dr. Shirlita Amler has joined us, that she's on the Zoom. I just heard from her. She's having some trouble with her video, but Dr. Amler is our greatly respected Commissioner of Health here in Westchester County. And she is a true example. And later on in the presentation, I have a slide about her partnering with the community in just about every way that helps possible, and for her Herculean efforts during COVID. So this is a great night. We may be few in numbers for this presentation, but I know that it will have enormous reach throughout New York Medical College. So I'm going to give an example right now of the Children's Environmental Health Center of the Hudson Valley. We're partnering, I mentioned earlier, with the American Lung Association, which is a national organization which has a statewide presence, and it also has a local presence, and with Roswell Park, their researchers, and Boston Children's Health physicians. We're partnering to promote tobacco cessation. And that's what is this slide, and that's what this is all about. We're trying to develop a systematic approach throughout the Boston Children's Health physicians' offices so that all patients or their family members are identified and given the help they need to quit smoking. Next slide, please. So you can go back. I'm not sure if the okay, if you want to go next. Okay, this is another example of the Children's Environmental Health Center partnering with early childhood agencies. This is a great way. If you have an interest in working with young children, it's a tremendous way to really impact public health and to create partnerships, right? All about SDG 3, promoting good health, by reaching out to the thousands of early childhood providers in our region. You know, I would say a couple years ago, right before COVID, we had a wonderful experience partnering with Head Start of Rockland and with Westchester, and we brought students and faculty members into the community. Next slide, please. So we wanted to make this interactive. Now we're going to share with you a group interactive exercise. It's a practical approach, and by doing an exercise together, we're going to start you thinking about how you can get involved in activities to promote SDG 3, good health for all, and SDG 17, which is partnerships. So if you would join us by taking a piece of paper or open up a doc, however you prefer to do it, and let's get started. Next slide. So if you look at this slide, we want you to start thinking. We want to relate what we're doing to you. How does this relate to you? So have you been engaged in a community service activity that is personally gratifying, but you're unsure if it bears professional value? So while you're at home, you can start writing down, and for some of you, it may be a few things, for others, it may be many. Start thinking about what you have done. Now, in the next column, start writing what makes it personally gratifying. What did you like about it? Or maybe you didn't like anything about it. That's okay. We're trying to relate SDG 3 and facilitating the community partnerships to you. We want to make it personally satisfying to you. Now, write down, when you look at each of these activities, why are you, if you can go back, please, why are you unsure if it carries professional value? So maybe you're thinking, this particular activity that I did 3 years ago, I don't know if it had meaning. I don't know if it has professional value. Write it down so that you can start after we get through this exercise. And not only in the PowerPoint tonight, but it could be tomorrow or another day. You can come back to it, and you can also address, why are you unsure if it carries professional value? Does it relate to SDG 3? Are you promoting good health? You heard Dr. Murthy talk all about the different targets for SDG 3 and the many ways you can promote SDG 3. Now you're thinking in the last column, how can my service activity help to integrate what SDG 3 and SDG 17 into my professional practice? Or if you're a student out there, or if you're a faculty member, how does it relate to your academic portfolio? I could tell you that with Dr. Murthy and myself, it relates very much. You can see in terms of being leads for SDG 3 with the Academic Impact Committee from the United Nations, and our research activities and our public health practice activities, Dr. Murthy's teaching, the applied practice experience, it relates. But we want you to use this slide to help you get going out there, to think of, because there are so many opportunities while you're at New York Medical College. You can choose mentors, you can choose clubs, you can come meet us at New York Medical College in the School of Health Sciences and Practice, and you can pursue an MPH degree, you can pursue a certificate, and you can even do an area of concentration in the medical school to promote health. Next slide, please. So aligning your passions, interests with your career. This is it. This is the goalpost here, aligning your passions, your interest with your career. So it's, if you look at all these concentric circles, they're not separate, they're all coming together. Personal passion. Think about, write down on that sheet, what is your personal passion? I talked earlier, or Dr. Murthy, we talked earlier about institutional mission and vision. And we talked about where we all have New York Medical College in common right now, whether we're students, whether we're faculty, employees, staff, community outreach, fostering community outreach, education, health promotion, population health, all intersects to our mission. It also intersects to many other missions out there, depending on where you live and what's happening in your local community. Value-based alignment. Think about the value. You have an interest. What kind of a value does that give to the population? We're looking for a great value for the population. And networking, community-specific needs or disparities. It's very important, and we have a great Office of Diversity and Inclusion that's led by Dr. Mill Etienne, and to really get out there and to partner with community organizations to reduce, to try to address, to help address the health disparities that are out there. What are your professional interests? Put it all together so that everybody is capable of advancing SDG 3, and an effective way to do it is by networks and partnerships. Next slide, please. This is another example where the American Heart Association, which is a national organization that has a very big presence locally here, reached out to Dr. Murthy and me because they were very concerned about mental health and the toll it's taking during COVID. So we were able to pull together a presentation that we did for them with student involvement. Next slide, please. Prevalence of mental illness, I think everything we read, it is rising dramatically. So from a value alignment standpoint, what I spoke about in the previous slide, there's a tremendous value to trying to address mental health. Mental health, as the American Heart Association says, is heart health. Next slide, please. This is the AHA statement on mental health, and they are saying that mental health is important to overall health, heart disease, prevention, and treatment, and that depression and negative psychological health conditions are associated with a less healthy heart and body. Optimism and other positive mental health status are associated with a healthier heart and body. Healthcare professionals should consider patients' psychological health when evaluating or treating people with or at risk for heart disease. We want to lead to a healthier heart and healthier body. Next slide. Dr. Murthy, if you could take it away with global partnering.
Yes, I think before that we have one more slide. Thank you. And I would like to say tell everybody that from AMWA, we had the privilege of honoring Dr. Amler during the Commission on Status of Women by presenting her a CSW inaugural award, along with one of our New York State Assembly women, Jennifer Rajkumar. And I see Dr. Solomon has joined us. Dr. Solomon, I just wanted to convey thanks to you from both Dr. Ansel and myself for organizing this event. So thank you. And just continuing, so what have we been doing? And the reason we want to showcase this is because, you know, New York Medical College, we are doing so much. So it's high time we start talking about it and getting the word across. So at the commemoration of the Alma Ata Declaration anniversary at the United Nations a few years ago, you can see there's Dr. Ansel. There is Dr. Michael Riley, who was our student for DRPH. He was on faculty and now he's finishing medical school here in NYMC. And then this is His Excellency Andrei Pirogov, who was the then executive director of the WHO office here. And then this is one of another high-ranking WHO staff. So why are we talking about Alma Ata? Because Alma Ata is the precursor for the Millennium Development Goals, the Sustainable Development Goals to promote health and well-being for all by 2000. 2000 came and went. We are now in 2022. We still don't have health and well-being for everybody, but it doesn't mean, like, I am an optimist, as is Dr. Ansel. We are saying the glass is half full, so we can do what we can to, do this. That's why it's all these actions, everybody. And to add to the exercise, what Dr. Ansel said, I would ask all of you to have a 1-minute elevator pitch, as I call it. So if you meet somebody, you need to say that you are all have an individual responsibility to ensure the health and well-being of all. And one of the perfect examples is do not litter, stop using plastic as much as you can. Use so that we don't litter our earth and our oceans, which are really, we are suffering. We have all these climate change, we have all these bizarre weather conditions due to climate change, and it also impacts our health. So in addition to all that, you need to have an elevator pitch to make sure you get people to listen to you.
Those are great points, Dr. Murthy. Okay.
Yeah, Dr. Ansel, and this is another slide where we are very involved in APHA. We've had students, and the other thing, Dr. Ansel and I, we worked on our book during COVID, on global health and technology, and where we had students work with us, and this is partnering, and we had contributors from 12 countries. So what I'm trying to tell you is, it's not that we are blowing our horn, but just to tell you that we were students like you, we started out, but we always have what can we do and how can we create a ripple effect. So this is with some of our colleagues at APHA, and she is now back in Australia. Remember her, Amy?
Yes, absolutely.
The Dean of Nursing, yes, very Patricia, who's very well known. She's back in one of the Australian universities while looking into the health of the indigenous population. Their health status has been neglected. Like we have the Indian Health Service here, they have that. So next slide, and it's over to you, Dr. Ansel.
This is a good example of partnering for policy. The Children's Environmental Health Center of the Hudson Valley, we received a proclamation for children's environmental health for our activities. And we recently learned that we're going to get another proclamation for our work in promoting children's environmental health. And this is something that's very doable. And we want to make sure that everybody knows this. It's by working together. Here at New York Medical College, we have a wonderful team of faculty. We have so many faculty that really care about the students. And Dr. Murthy and I have been here many, many years. So reach out to us, get involved. There are so many ways that as you get involved, you learn and you enhance, your skills. At the same time, you're enhancing the quality of life for many other people. Next slide, please. These are some examples of some students. These are physical therapy students doing some fit testing with assisted living, facilities up in Rockland County. It's a great example of meeting SDGs through physical activity. Next slide. Dr. Shirlita Amler is pictured in this slide. We were actually giving a presentation. She was presenting in Westchester County awards to so many doctors and grassroots community activists, people who are advocating. You too can become an advocate for a healthy population. You too can become an advocate for SDG 3 and for community partnerships. Next slide, please. This is a health fair at White Plains Hospital. Our chair of speech and language pathology, Dr. Franklin's there with Dr. Grover. I'm there with a whole bunch of students, and this is another example where we're promoting to the community. White Plains is a very big city, and together there must have been about 35 community agencies. We all came together to promote health. Next slide, please. This is an example of another health promotion activity that we did with Dr. Etienne and with students, where we worked with the White Plains Youth Bureau, and we also worked with the Speech and Language Pathology Department at New York Medical College, the Public Health Department, the Department of Physical Therapy. Dr. Jeannie Wilson brought everyone to the Clinical Simulation Center on Dana Road. And this whole initiative, it's a pathways initiative to promote careers in medicine, in speech language pathology, in physical therapy, in public health, in nursing for underrepresented youth. And it was very, very successful. And this is something where we all pulled together at New York Medical College, students, faculty, and community. Students, faculty, and community. This is a combination that's a winning team to promote SDG 3. Next slide.
So thank you, Dr. Ansel. And I just wanted to add one thing as we both wrap up is, remember, teamwork is what gets you results. Like 10 fingers or 2 hands can do so much more than 1 finger or 1 hand. So by partnering, you're building bridges. Everybody has place under the sun. So don't think, oh, by sharing or working with a colleague, you're losing your glory. No, because we're all in this together. We need to make a difference for not only our generation, but the future generations, because folks, we are in trouble. There's only one planet Earth. So with that, think globally, but act locally. So every action of yours, you don't have to think, I don't care what these, our professors are talking. I'm just bothered about myself. But if you do that, you have the power. You can unleash your power to make a difference. And critical thinking skills are crucial. That's why we post all this information, those of you, and it's very nice. We have from our own office, Stefania, who's great. We send her stuff, she shares it out. You can build your skill set outside of the classroom by attending conferences virtually. One of the advantages of COVID is you can attend a conference anywhere virtually by reducing carbon footprints and also cost, because you learn. You all need to be like SpongeBob SquarePants, and they're not paying me to talk about that, but it's a beautiful example of how you can absorb information. We learn from you as much as you learn from us, and we teach each other. And again, you need to incorporate the goals and targets. For example, Dr. Ansel said, yeah, we have MPH program, we have certificates, we have a certificate in global health, we have a certificate in health education. So learn this. We have a certificate. I think the speech pathology has a certificate. So just make use of all these resources available, because you're lucky to be in a place where you can have access. And when we think, we need to think of how are we going to incorporate these goals to make a difference in our lives personally, in the communities, state level, national level, and globally, and identify naturally occurring or organic partnerships. Reach out to your faculty, send an email, look at what conferences there are, share it with people. And again, reach out to mentors. We all would not have been here if we didn't have great mentors, right, Dr. Ansel?
Absolutely.
And also, I would like to give a shout out on behalf of Dr. Ansel and myself to Dr. Dean, our Dean, Dr. Robert Amler, who is a great captain of the ship, and he really has created an environment where we can learn, we give back, we get so much. So that is really, we are very fortunate to have a dean with so much of, what shall I say, foresight, and also our own chancellor, Dr. Halpern, who is also very supportive to all the 3 schools. And with that, we just have a thank you slide in all the languages here, because it is global goals and it is the week at the UN. And again, thank you all. And now we have the floor open for Q&A. Dr. Ansel, do you want to say anything? Dr. Solomon, do you want to say anything, because you're on and you worked with the Office of Diversity and Inclusion to have this? Or Dr. Amler, who's here?
I'd just like to say to both of you, both Dr. Ansel and Dr. Murthy, thank you very much for this wonderful presentation. I think it's great to see how we can all chip in and make a difference.
Thank you, Dr. Solomon, and we appreciate the opportunity to be here with you and faculty, and this presentation is being recorded, so we will have, great reach, throughout the New York Medical College campus and to the affiliates. Thank you for that opportunity.
And also, I would like to say that there's an SDG conference coming up in Utah. Again, I'm going to send the link over to the office, which will be shared, and it's free for students to register. You can register virtually. It is the first time there is an SDG conference being held ever. And it's in conjunction with the United Nations Department of Global Communication, the United Nations Association, the United Nations Academic Impact, and also the Utah Valley University. It is really a great tool. And we are so fortunate, New York Medical College. And again, that's thanks to Dr. Robert Amler and Amy, remember Dr. Ralph O'Connell, who
Yes.
were instrumental when I came up and I said, this is there, can we join? They said, absolutely. So we are so proud that New York Medical College School of Health Sciences and Practice is one of the founding members of the United Nations Academic Impact. And because of all the work we've been doing, we are a team, and that's why we were recognized as a SDG3 hub, which is really a great honor. And in this cycle, we were the only American university recognized as the SDG3 hub. That is the New York Medical College School of Health Sciences and Practice. And so it always gives us great pleasure, Dr. Ansel and I, to work with all of you. So over to you, Dr. Amler.
Dr. Amler would like to say something, and she's having trouble. I'm not sure whether or not, Jason, you can unmute her because she's having trouble unmuting.
Yeah, I could try.
You could try.
Okay, great.
So can you hear me now?
Yeah.
Yes.
Yes.
Yes. I just wanted to share with you that I think that here you have 2 of the best mentors of all time, and that is Dr. Murphy and Dr. Ansel, and there are no better mentors in the area of public health and medicine. And on top of that, we have Dr. Solomon with us. So it's like you just have the best of all possible worlds. But as somebody who has spent their life in public health and in medicine, I can't think of any other profession that could bring such personal satisfaction and at the same time give you the ability to impact the lives of people to the degree that you can in public health. When I practiced medicine, which I loved as a clinician, I loved doing that. I was changing and hopefully helping the individual in front of me. But as Commissioner of Health for Westchester County, I get the pleasure of impacting the health of the 1 million residents of Westchester County. And that is just a tremendous honor that I feel. And so I would encourage anyone who is interested in public health, to pursue their goal in this, because it really is a wonderful profession and you really do have the ability to really change and impact people's lives. And thank you all for including me. Thank you.
Thank
Thank
you.
you
We
so
appreciate
much.
that you join us, our Commissioner of Health. That's really awesome. Thank you.
And also in her own right, bragging rights, Dr. AMWA has done, she's so modest, outstanding work when she was in the CDC too. And also our students who did their internships in the Department of Health, right, Amy? They
Oh,
just
absolutely.
loved
It's
it.
an
Yeah,
we
they
have-
really loved it.
And
And you
many
are
MD, MPH students, I just
Yes.
want to add. And Dr. Murphy, for many years, you were the almost like the advisor to all the MD, MPH students, the combined
yes.
degree. You did a great job.
I thank you. They did like it. But again, to say, it's really great to have been given the opportunity. Thank you so much, Laurie. And also, Amy, I mean, like I couldn't have asked for a better partner in crime in public health.
Thank you. It's mutual. Thank you all. And thank you. I
Thank
see
you
there's
all.
so
And
many.
thank you so much also to Dr. Franklin, Kate, and all of our other colleagues who joined us. And Jason, thank you very much. And also to Dr. Etienne. And once you have the recording, please share it with us because I think this is an important presentation which needs to be shared by everybody. Thank you all.
Thank you all. Thank you.
Thank you.
And we're on time. It's